We know last year there were reports of 11% of businesses facing at least one cyber attack.
We had to face a cyber attack recently. It's not directly to us. We use a third-party care planning software provider. The provider is highly trusted. A lot of other companies also use the provider. They had a system update. So they inform us they're gonna shut down the system for 2 hours. Like after 2 hours it's not coming back, so we check with them, then they inform us like, yeah, we're experiencing a cyber attack, there is a ransomware attack.
Care services should care about data security because they need to ensure that they protect their organisation with regards to digital and paper records.
So data protection and cyber security is really important because we have a lot of personal data from people.
But what's important is the whole top of the chain to the bottom of the chain, they have to understand the meaning of data protection.
Our individuals' data is trusted to us and we need to ensure that that is protected. Every year we see an increase in cybercrime. It is more sophisticated day by day.
And people trust us with their data and they trust us to be able to keep it safe. That's from our staff to our clients as well. And it's important that they know that we've got measures in place to keep their data and all their personal information private and protected.
Before using the DSPT tool, I was not knowledgeable at all.
I'm so grateful that I made this right at the beginning of my business because I don't know how I was going to navigate going forward. So it gave me kind of like the tools. So it's a toolkit, but it actually handed me the tools of how I can manage sensitive information and data.
MCare is one of 28 local support organisations across the country that works with the BSPC, the Better Security, Better Care programme. Us, as an LSO, we provide multiple variants of support to CQC registered providers in Leicestershire and Rutland. We do this by providing webinars, online workshops, face-to-face workshops, one-to-ones and any other support that's required for any queries that providers have.
So I'm Baz Kanabar, the Project Delivery Officer. I work on behalf of MCare and I work on the Better Security, Better Care project. We try to work with lots of people in terms of referrals, but also to make sure that they understand what the DSPT is about, how it's going to benefit them. And so it's an opportunity for them to come in on board into the face-to-face training. The DSPT is a good framework to find out where there's gaps in your business. We can provide you and guide you through where you need to find those little holes in your business. By having the platform with the DSPT, we're saying to them you're going to be better in the world of digital because you can actually access the service records and therefore you can help that service use 100%.
So before we came onto the DSPT training, we didn't know how much we had in place, but when we actually come on the training, it highlighted it for us how much we did actually have in place, and we were pleasantly surprised with that. We did pick a lot of things up from the training though. For example, we weren't aware of the type of security that our rostering system had in place. So after the training, we went back and we looked into that and we were pleasantly surprised with that as well. But there's extra things we've put in place to make sure that we're extra protected.
DSPT, like it helps you, it's a self-assessment. So if you go through that and the things the DSPT request, then you can provide some kind of satisfactory level of security.
So for us as an organisation, I think it was very, very limited knowledge, but now the advantage is that with that knowledge, we've expanded and progressed with the NHS.
After the training, we know now, we understand as well how to handle the information and update the security patches between our computers, notebooks, mobile phones, and keep the data safe and secure.
They will either come to your organization or you can come to them over the telephone. They can do a Teams meeting, so whichever way is easier for you, they are there to help, and it makes such a difference in your business.
I'd actually booked tickets to go to Africa because of family situations, so I couldn't come for a one-on-one face-to-face. But when I mentioned this to the people who were giving us the training, you will not believe that Baz actually took a day out and Zoom, and I was seated in Africa, right at the bottom of Africa, doing a one-on-one to finish the training. I get emotional. that was like, my goodness, they're actually good people out there. The support was amazing. So it just spoke me through everything in order to finish the training and meet the deadline for the tender, which, by the way, it was awarded to me. New provider, I've got a tender with Nottinghamshire, because I did the training and I got the tools. And I think the commissioners looked at everything that I was writing about, that I learned from the training, hence I got the tender.
I still feel like, even though we have done the training, we have already started doing things, I still want to go and have more training, because it just opens so many avenues, so many things we didn't know as a business, and also it just gives clarity and confidence to, to discuss with your clients, your service users, to say, we have done everything possible to make sure that your protection, your information is protected. And also with any other business we're going to be working with, we will be saying that we have done this, we are doing this, and everything is protected.